I'm Al Ali, and I'm very excited that you're going to have surgery done with us. And I really would encourage you to spend some time looking at these videos because they're extremely helpful to your recovery. It's an exciting time for you, and we're excited, and we're here to help you. And I think these videos will help get you there. I'll first start out by telling you that we will give you a set of prescriptions, and I write them on the day that you come in for your preoperative visit, and they will go to the pharmacy that's on your medical records. And I would really prefer that you pick them up before you come to surgery. So on the day that we see you, please pick them up, because after surgery, it's very uncomfortable and inconvenient for you as you're driving home to pick them up, or your loved ones. It's just better if you have them, you leave them at home. You don't need them in the hospital, but we want you to just pick them up. It's a lot better. And we're going to talk about them in detail a little bit later in this video. We inject every area that we operate on with a local anesthetic that lasts anywhere from 48 hours to 72 hours. It's an amazing medication, and it really works out really well. It has changed the way we do surgery. Patients really are much more comfortable than previously. The worst pain occurs within the first 6 to 8 hours after surgery, and certainly during that period of time, that medication is very effective. And as it slowly wears off, it doesn't wear off instantly. It wears off very slowly. You start taking these other medications, which we'll talk about. What are those 4 pain medications other than the injectable material that we use in the OR? First, we use high-dose Tylenol. Second, we use gabapentin, which is a direct nerve pain reliever. And then the one before last is we use Celebrex. Celebrex is very much like Motrin, but it's a longer lasting medication. And I know some bariatric surgeons don't like you to be on that drug or that class of drugs, but we've had some pretty good success as long as it's a short period of time while you're recovering from surgery. The last medication that is a non-narcotic is a steroid that we use. Now, this steroid is a pack of 6 days of steroids. You start out with 6 pills, then the next day it's 5, 4, 3, 2, so you decrease each day. The way steroids work is they reduce inflammation, and they also reduce swelling, which is an indirect painkiller. So we would like you to take that. All 4 of these work on different mechanisms. So you could take them all together, or you could take 1 or 2, but except for the steroids, I'd like you to take that all the time. The other 3 you can alternate or not use them, or use them as needed. We also give you something called Colace, which is a stool softener. It'll help you. Now, if you do anything else that helps you move your bowels, please do that. Whether it's drinking coffee, certain foods that really get you going, but we really want you to have a bowel movement as early as possible. Other medication that we use is related to the fact that we don't use drains on anything that we do. It's a very mild diuretic, and it's called hydrochlorothiazide. The short term is HCTZ. It's a very low dose of this medication, and it gets rid of fluid from your body. A lot of the pharmacies will ask you if you have hypertension, because it's usually used for high blood pressure. It's not being used for that in this particular situation. It's just to reduce fluid from your body. People tell you to drink a lot, very large amounts of fluid after surgery. We really don't want you to do that, because what happens after surgery is all that fluid will go into the area that we operated on. It can cause fluid collections, which are called seromas. So we want you to drink, stay hydrated, but only enough so your mouth is not dry. And this medication will be the one that you'll be using the longest. It's for 30 days after surgery. The last medication that we will give you is something that helps you reduce nausea. It's called Zofran, and you only take it if you're having trouble with nausea. Again, all of these things are going to be at the pharmacy, and please pick them up as soon as you can prior to surgery. The patient information sheet, which you probably already have, we will give you again in the preoperative period, and it really has pretty much all the information that's included here in this video, but we just want you to have it in written form. You can refer to it, and it's a very good source of information for you. If there are questions that are not answered, please don't hesitate to contact our office.